Hi, my name is Wayne Guerra, and I'm the Chief Medical Officer and co-founder of iTriage. IBS, or irritable bowel syndrome, is actually the most common gastrointestinal medical condition, or medical condition that involves your intestines. It affects about 15% of the population in the U.S. No one really knows what causes it, but it is a disorder of the intestines, primarily the large intestine, and it causes abdominal pain, diarrhea that then fluctuates with constipation, can have nausea and vomiting. It can be quite severe at times, and even sometimes depression. There really aren't specifically different types of IBS, but IBS can certainly affect people either mildly or severely. So some patients have symptoms that only occasionally disrupt their lives, while other patients can have symptoms that can be quite debilitating. IBS is thought to be thought to be caused by a disorder of the muscles of the intestines or the nerves of the intestines. What typically happens is when a patient's experiencing the constipation component, and it's primarily in the colon isn't contracting normally, or large intestines aren't contracting normally, and that causes constipation and the bloated feeling that people have and the abdominal swelling that they have. And then they'll have periods where there's sort of an over-contraction of the muscles. Now they're contracting too strongly, causing the diarrhea that patients see or experience, because now the food that you eat travels much too quickly through the large bowel or intestine, and that can also cause the pain and cramping that patients experience. Some researchers think it has to do with an abnormal level of serotonin, which is what we call a neurotransmitter. But those research studies are still being done. So the exact cause isn't known. It is known that this normally starts in the teenage years, affects women more commonly than men, but it can happen at any age, and also in males. And if your mother or father or siblings have the disorder, you have a higher likelihood of getting this medical condition as well. That's a really good question, because most patients and most physicians that are treating patients will benefit most if they can figure out what are their triggers. So the most common food triggers are caffeine, so soda pop that we all drink, and coffee and other foods that have caffeine. Dairy products can be significant triggers. So can alcohol, as well as becoming dehydrated. So it's super important to keep a log of the things you're eating and the things that you're experiencing, and then you can help remove those triggers. The exact role that stress plays is still being sort of figured out. It certainly doesn't cause irritable bowel syndrome, but again, it can be a trigger and significantly worsen the symptoms. So if patients can try to avoid those situations that they know are more likely to cause their symptoms, then they can have a symptom-free, or at least decrease their symptoms in their lives.